Everyone, so my name is EJ, and I'll be speaking to you today about loss of health from my lived experience, and I would like some participation because I'll just ask a bit of questions, reflections. So as she said, I did my master's dissertation on my lived experience with lupus using orthoethnography. So I'll start by this first impression, assessing health on appearance. So I'd like you to look at this lady. What if you assess her by her physical features? What does she look like? Can you come up with a word?
Alpha.
Okay, then look at me. What do I look like?
Alpha.
Brilliant. Okay, so let's look at them pictures. The lady, she's in a wheelchair. What does she look like?
Alpha.
Any other thoughts?
Creative. Disabled.
Content.
What if, imagine that I pulled up here on a wheelchair. How would you view me?
Same. Don't see any difference.
You're still the same person.
You notice that there's a disability, but doesn't necessarily mean you're unhealthy. Just the disability.
Yeah. So that's the picture. So with chronic illness, you can never see the person as disabled. So if I might be exhausted, but when you look at me, you would say, she's pretty well. You look healthy. What is wrong with you? You know? So that's what autoimmunity is. So autoimmune disease, chronic illness, occurs when the normal immune system, which is meant to fight off diseases, is actually fighting your organs. And it fights your cells wherever it wants to attack, it attacks. So it's quite unpredictable. So there are several examples like rheumatoid arthritis, type 1 diabetes, multiple sclerosis, fibromyalgia, and lupus, which is what I'll be talking about today because it's what I have. So my immune system is making antibodies that would normally fight infections, but instead it's fighting my organs. So it affects, mainly women have more impact of severity than that of men, and affects women from childbearing age. So what does it affect? So from my experience, it started with my kidneys, but I had pre-existing illness, but I was in Nigeria. I had so many illnesses. I had tumor in my stomach, I had seizures, I had heart palpitations, so whatever, my mom has seen it all. But it wasn't diagnosed then because back in Nigeria, there was no medical facility to know what is happening to me. But I had a respite period that I had no illness before I came to England, and then it started again. Affected my kidneys. The unpredictability of the illness, just like Joe said, meant that at that point when it started, I could not get employed because I was tired. My fingers were blistering. I had all sorts of illnesses that were not controllable then. The thing is, it doesn't just impact my physical health. It did impact me mentally, because how would I understand that a 26-year-old that is a mother was still so dependent on her own mother for help for practically everything. So what did I have? So neuropathy, Baker's cysts, loss of bone in my knee, degenerative knee, and every time I've had 2 surgeries in both knees and both ankles at the same time, and I've had another surgery in my left knee, and I'm waiting for another arthroscopy in my left knee. So whatever it comes with, we face it. My first treatment was a chemotherapy to save my kidneys from failing, a cocktail of medications, biological treatments that are now working. So to maintain my health stability, I have to be in hospital every month to have treatments, to have infusions. And then 3 times in a year or twice in a year, I would go in for a week to have infusions for 1 week to help keep my Raynaud's stable. So this is just that journey of health. So what I've done, and I hope this helps you with your assignment, is to use the Kubler-Ross 5-stage of grief to explain my process. So first is the denial stage. I remember when I went to the doctors. Okay, first of all, when I was diagnosed, I was on my way to the airport to go to Nigeria, and my GP called me and said, "You need to come in." But that's a story for another day. But I was going to Nigeria, and nothing was going to stop me from going there. On my way back, why I actually came back was because I was pregnant. And then it occurred to me that I'm not just dealing with myself anymore, that I have a child, so I need to come back to know what is actually wrong with me. When I got back to England, nothing could be done for me. So I didn't even know I had lupus. I just knew there was something definitely wrong. My fingers were swelling up. So my GP said I would have to have the baby first, then I would be referred to a rheumatologist. When I was referred after having my baby, 2 months, I went to the doctor, and she said to me, "Have you ever had a miscarriage before?" I said, "No." They found protein in my urine, and they said, "Okay, we need to check this. You have lupus." I didn't understand what she was saying. I was like, lupus is like in the family of arthritis, and I think your kidneys are affected. I was clueless. Seriously, I was in another world. I didn't understand the English she was speaking. What I did is, I got home, I said to my mom, they said there's something called lupus that is wrong with me, that is affecting my kidneys, and I have to be on this drug, and I need to stop breastfeeding. So that was what I felt then. My mom's denial was, "You know what, nothing is wrong with you in Jesus' name." And I said, "Amen." So that was, I believed that it would be like a malaria that would go after a few weeks or treatment. I didn't know I would go down the path that I was actually heading down. Then anger, and blaming. So as you remember, I said I went to Nigeria and nothing was going to bring me back. I was actually going. So that journey to Nigeria, when this happened, I felt it was my stubbornness that brought this on me. And I don't know if it was mixed with postnatal depression, but I will wake up at night and I'll start crying that I have actually brought this on me. Maybe God was punishing me for disobeying my mother, for not listening, for following my path, the path that I felt was right. Anything made me angry. A little argument felt like, "Oh, it's because this is happening to me, that's why you have a right to talk to me like this. Oh, it's because I'm not working, that is..." I think I had an argument with my mom about sardine, and I ate some sardines, so it felt like I was eating sardines every day. And she was the one working, I wasn't working. So she said to me, "Why would you eat this every day?" And I felt like, what rubbish. Is it because I'm not working? That's why you talk to me like this? So everything felt like everyone was fighting me. It's because of I'm feeling this way. It's because I'm well. Don't worry, I'll get better and I'll show you. And then deep within me, I'll ask myself, why me? Why should I shut myself away from my friends? At the age, everyone was thinking, "Oh, I'm doing this." They're high flyers, and my profession was being unwell. and being unwell that no one could understand what was actually going on with me. There was no quick fix. My bargaining. So I'm Christian. So prayer and faith is actually really important to me and has been important through all my journey. However, I felt that you hear stories of healing and recovery and miracles, and I've had my own share of miracle, but this time I wanted to bargain with God. You know what? I'm going to go to Mass every morning. Maybe if I keep on going, you would heal me. So one day I'll pull up in the hospital and the doctor will say, oh, your lupus is vanished. That was the bargain I was making. I needed something to hold on to tell me that this is going to go away. I wouldn't understand that I didn't have cancer and I have to have chemotherapy, or that I could wake up and my whole body is swollen, or I could wake up and my mom has to give me a wash in bed. Why? I needed something. God, I'm coming to you in church to heal me. And then a friend of ours said to me, EJ, you don't have to come to church every day. If you're tired, you need to rest. But I thought if I showed up, maybe something would happen. I can remember going to church one day, and then because of my kidneys, I had fluid retention in my legs, so I couldn't wear shoes. I had to wear Crocs, and those were the days when Crocs were not in vogue, and now it's actually in vogue. So I started that trend. And because how heavy I was just dragging myself to go to the bus. That faith of maybe if he keeps seeing me, I will be healed. So I got to church, and there's some reading in the reading that was read that said that the oil in the jar would not get spent until he sends rain. And I sat there and I wept, and my weeping was when I hope this happens to me. Like, I was tired. I couldn't look at myself in the mirror. I was puffy everywhere. You couldn't even recognize me. Just that showing up was what I needed. Depression. I felt I was better off dead. I wasn't suicidal, but I felt it was better that I'd go to bed and not wake up, because I felt I was dragging my mom and my son down. My little son was about, when he was born, I was always tired, Whenever I'm left with him in the sitting room, and what I do, because when he was crawling, what I'll do is I'll push one of the chairs to the door so that he doesn't crawl out. Then he can just crawl around the sitting room, then I can lie down. And when he's jumping and playing around me, it hurts, So I felt sad. I couldn't do what other mothers did. I tried, but most times I was so knackered to even do anything. So I sunk into that state that maybe if I'm gone, they both might have a better life. That was my rationale for wanting to go in peacefully, not like making anyone maybe committed suicide or something like that. No, but I just needed to leave. So sleeping on my bed in agony, hoping that one day I will shut my eyes and not wake up, and they will be better off than myself. Then acceptance, recognizing the reality of the difficult diagnosis while no longer protesting or struggling against it. I had to understand that my lupus was here to stay. But maybe I could do something to help myself. And not something grand, but something little that would just take me out of the house once in a while. And I started volunteering at the hospital that was going to St. Helier in London. And the volunteer team, I couldn't stand in the till to take money. I couldn't do sales. So what I did was to sit in with this lovely old lady too, that's a cancer survivor, and we'll count the money that we made in sales and we'll have a chat. That was my process of accepting what I have. So I also use the wording 4 basic tasks in adapting to loss. So accepting the reality of loss, my reality was that there was no quick fix. My body was prone to fatigue, pain, infection, immobility. I might need to be in bed the whole day. I would accept that. The need to adhere to my medication to allow me move on. I needed to accept that I have to be on this medication, so it's not like I'll have a medication for like 6 weeks and then that's it. No, I just have to be on the medication for the rest of my life. Experience pain of grief, the pain of loss, sadness, anger, and confusion. So I lost control of my body. My life turned upside down. I needed physical and emotional support, and thankfully I had a secure attachment with my mom. I had an uncle that would always come to hospital every day to see me. He would finish work, call the house and tell them he's coming over, he would take food and he would bring it to the hospital. So that I had. So that support was very, very essential for me. They weren't questioning when my illness would be going. They knew, they were there for the long run. Then adjusting to environment. I refocused on being a parent, taking my son to playgroup, library, swimming when I can. So it's only when I am physically able to do that I do. And when I can, I do it. But when I can't, I just let go and rest. Redirecting emotional energy. So redirecting one's emotional energy from suffering the loss of a loved one or engaging in new activities that bring pleasure, new experience. And that's how I started volunteering, even in church, to count the money after Sundays. So just something to get me out of the house, to distract me from just that one-way streak of just going to hospital, going to church, and that's it. Something to bring back a life into me, to breathe life into me. So, what do these words mean to you? If you don't mind, just write it down. What does recovery mean to you? So recovery, miracle, healing. What do they mean to you? Would anyone like to share what they wrote down for each one?
I don't mind.
Go on.
So for recovery, I put getting better. For miracle, I wrote something unexpected happens that you feel shouldn't happen.
Okay.
And healing, coming to terms with something so it doesn't affect you anymore.
Thank you. Anyone else?
I did for recovery, I put as a start of the journey to healing. Miracle, I put that down as I found a method, a way to do this, a way to recover. And for healing, that's a return to the norm, my norm.
Thank you.
I put for recovery healing, because for me recovering is the start of the process for healing. Whatever I'm going through. For miracle, I put overcome the impossible. And healing, I chose resilience.
Thank you. Anyone else want to share? Okay. So recovery. Personal recovery is defined as a deeply personal, unique process of changing one's attitudes, values, feelings, goals, skills, and or roles, a way of living a satisfying, hopeful, productive life, even with the limitations caused by illness. So it's part of everything that you've said that recovery is. So what I've added to my own life experience is the CHIME recovery framework. If you all know about CHIME in positive psychology. So that's connectedness, hope and optimism, identity, meaning in life, and empowerment. So what I added, because of my own history and of my own life, is PAA plus the G in addition to CHIME framework. So the P is pain, acceptance, adaptation, and the G goes after the E in the CHIME, I'll show you later, which is growth. So this was created out of my autoethnographic account in my thesis. My lupus experience has been a journey of pain, both physical and psychological. The tumultuous journey that has also led to self-reflection, rediscovery, purpose, meaning, and empowerment. Accepting the unpredictability of the disease and adapting to my new normal. So here is the PAA CHIME G. Pain, that's the physical and psychological pain. Acceptance, adaptation, connectedness, hope, identity, meaning, empowerment, and growth. So what is pain? An inherent adaptive reaction that safeguards our physical well-being, shielding our body from the real and potential harm. It can give a rise to distress and impose significant burden. So that's the pain when I have, from the crown of my head to the sole of my feet, I'm in agony. There's this treatment I used to have, it's called Alupro. So whenever it's put in me, I am in agony, like pain. Then besides that, you can wake up with a lot of pain that doesn't allow you to get out of bed. Even for someone to touch me, that is so agonizing. So that's the pain I go through. And I've shown some pictures of, because I get poked and prodded a lot, sometimes it's quite difficult to get my veins. So one time they had to put it on my leg, and that was quite uncomfortable. And then my Raynaud's in my fingers. So mentally I was distressed and isolated because there are things I couldn't do. I couldn't show up. I just didn't like myself. That's just it. I just didn't like the way I looked. I didn't like the way I feel. So everything internal was actually coming out externally because I just couldn't look at myself and be happy. But however, I'd learned to accept, because sometimes when you struggle a lot and you see that you're not going anywhere, there are two decisions: to move on, and hopefully if you have support that would help you, or that innate strength to help you move on, your only option is to accept it and to find a way to thrive and be happy and be content. My faith was one thing that was so important that helped me through. Growing up, my mom always took me to church. My mom would say that my health issues while I was young built her faith. But as an adult, my health issue now built my own faith. So faith was so important. It is so important. My memory is toast. Shaha, my friend here, would tell you how many times I would say, what is this? And she said, I've shown you this before. And I'm like, oh yeah, you did. I forget a lot. I could buy something in the shop and I go home, my mom would say, how much is that? And I'm like, I don't know. I'm not being vain, it's just that I can't remember, you know. We're talking, I could write my essays and everything, and then after a few weeks I'll come back and read it and I'll be like, oh wow, I actually did write that. Oh, that's good. You know, so that's just it, you know. I keep forgetting, and I've learned to accept that I forget, you know. And I've tried not to keep explaining, but I will explain when the need arises that I expect that. My second home is the hospital. I always have to go there. Accepting my disability helped me to discover my capabilities. I knew where my limits are, but I started looking for where I could thrive in. So anything physical I can't do, sorry. You know, but if I can offer myself, be it in church, wherever whatever I have can serve, then I do, you know. But I know where my limitations are. But however, there is more to me than lupus. Adapting. So this was quite difficult because I could not accept that a young woman in her early 30s then would have a stair lift at home. It was just not good because if it was for my mom, then yeah, I had that talk with my mom. She was like, "You need the stair lift." I'm like, "No, I will be better." And will they take the stair lift off? But I have found that I've always needed that. There's some days I'm okay and I can walk the steps, but there's some days I can't. And then accepting and adapting to using that stair lift to go up and down the stairs comes in handy. So everything is placed where it should be so that when I need it, I will be able to use it. So the stair lift, the crutches, the Zimmer frame, the walking stick in the car, whatever it is that makes life comfortable, the gloves underneath the pillow, the gloves in my bag, hand warmers, all those things needed to be accessible so that I'm comfortable enough to cope as I go on the day. So there's something else I need to talk about, acceptance. So acceptance doesn't mean that you totally, everything is fine. Acceptance is always tested. Because sometimes I am fine. I don't have any issues. I'm doing well. My medication is going. Then all of a sudden, and that's part of the unpredictable nature of lupus or any chronic illness, all of a sudden something happens to remind you that you're not totally fine. An experience of that was last year we went for a retreat with my mom, and then my knee started locking. So all of a sudden my knee will lock and I can't move. And I remember weeping. The weeping was about, again, I thought I'd gone through this enough. Why me? So acceptance is always tested. So that made me feel, I thought I had accepted this illness, but it felt like I'd made 10 steps forward and 20 steps backwards. So I needed to renew my acceptance again. So every time acceptance is questioned and we just keep moving. So my personal process of time, I have a secure attachment with my mom. She's been a constant factor in my life. I don't know where I'll be without her. Then having my son gave me a reason to live, because I was no longer living for myself. I had another human being depending on me. My church community actively getting involved, be it in reading, just those little things that matter. And I think when I talk to clients, when we talk, and I feel that the big picture, the overwhelming picture is not what matters. I think the little ones you do helps you, are those building blocks that we keep moving gradually. So my church was a good community. when I started my MSc here, I started making friends. Because when you're isolated for so long, communication becomes weird. I don't know how to make friends. Social intelligence just vamoosed, like vavavoo, yeah? So that was difficult. How do I approach people? You know, even the former workplace I volunteered, it was hard. Because I've been isolated for so long. Human community, it was just a little boy and my mom that I might argue with all the time or say yes to all the time. So having that so coming to uni, making friends, studying with people was so good for me. Hope and optimism. I've started my PhD studies. It's quite scary, but I have the likes of Shahar here that helps me through, and Joanna here that studies with me. I have my counseling practice now progressing. And I would tell you that in 2012, when that diagnosis was made, life felt it was ended. So no stress, no vision, no hope. It was rock bottom. But somehow I'm here today. To provide for my mom is also something I'm yearning to do more of, because I have been financially dependent on her as a child, as an adult, all through, and she's never complaining. But I hope that someday I could make up for that. And I'm hopeful that tomorrow will be better. I can't see, some days I can't see the other end of the tunnel, the light. I can't see it. But somehow I have hope that if I'm able to be here now, something will push me to be there tomorrow. Identity. I am a proud mom. I'm so happy that I am a mom. It felt like everything that has come out of this whole thing, that child is a beacon of hope for me. My health condition no longer defines me. I am a practicing counselor, and I'm proud that there is something that I can do more than sit in the hospital, or more than everyone calling, how is EJ in my language, Igbo, Keduk EJ me, or how is EJ? It felt like everyone was calling to know, is she still alive? Is she gone? Or, you know, but now, oh, are you at work? Oh yes, I'm at work. It brings sorts of pride. You know, even my mom was so excited today. I said, oh, I'm actually going to give a lecture to year 3 students. Oh. And she saw me just say, you look the part. And that is an identity. Everyone here, we're going through stuff in our personal lives. Difficult things that we see everyone, and everyone looks healthy and normal, but we all have things we're struggling with. But if you made it here today, you'll still make it tomorrow. And there is more to you than whatever you feel you're going through. If you've made it a part of you to come into this lecture and be in your 3rd year, oh my goodness, what would you achieve tomorrow? Just keep it there. You're more than your limitation, than your disability, down everything that is holding you back. You're more to life. There's more to life in you than that. Meaning, and I've said, faith-infused hope, optimism, resilience, and growth. Lupus made me appreciate life more. So there was a time before I had my avascular necrosis on both knees and ankles. I had to walk with stick a lot. So going to pick my son from school, it was difficult to hold him, drag my stick, and that movement, you know. That was quite difficult for me. But the time I was able not to walk with the stick and I could walk on my own, I found it was priceless just to walk and just put my hand in my pocket. I found it so pleasurable that I could hold my son's hand and we could walk. And the truth is, sometimes it's the little things that make a lot of difference in our lives. It brings us peace, calm, hopefulness. There's this sense of pleasure that no one can describe, but it's there. So those little things brought meaning. I would like to spend time at home with my family and not in hospital. Grateful that I am in a country that caters for my medical needs. Inspiring other people never to give up hope. Empowerment. I stopped working from 2011 to 2018. 2018 started volunteering. Because I wasn't doing anything, I started a youth group in my church. So I started working towards 2019 as a learning support, so paid employment, so you could see the movement. So graduated with distinction. I don't know how that happened, but it happened. And I gave my first presentation at what's it called again? PhD Students Conference. And I'm speaking here today. So that's empowerment. Then another story of empowerment, when the instances. So when I passed my driving test, I tried 3 times. The third time I passed, oh my goodness. Oh dear Lord. Oh, it felt like, because I think why it was so important to me to pass that test, it was everybody around me said to me, your mom will be driving you more. Why not use that money that you're using to learn driving to give it to her so she'll drive more? But no, I wanted to. I would fail. I would book another test, even the writing one, to tell you how bad. I think I wrote more than 5 times the writing test. And the driving, that day I passed, it empowered me. And it empowered me. So I was going to the hospital, I was walking, my mom was looking at me from behind and said, where has my daughter gone? But that's empowering. Another empowering part was when I got my residency. There was a sense of freedom. I went through that journey of immigration, going to detention center to get stamped and all that. So that process. But when I got that residency card, it empowered me. It made me feel so liberated that I applied to volunteer at Bolton Lads and Girls Club because I felt nothing is holding me back anymore. So every process of achieving something, no matter how little, empowers us. Working at Hopwood Hall College empowered me to apply for MSc. Doing my MSc empowered me to start doing my PhD. So every step empowers us, and that's the growth. So after empowerment comes growth. Post-traumatic growth, every pain that we're going through redefines us. So it's like gold being put in fire, and it's purified with that fire. So whatever we're going through now, just see it as you're being purified. Mental development. Although sometimes I still feel clueless, but still, there's still growth within this somehow. Rediscovering of self and strength. A step further from coping to thriving or flourishing. So my recovery is accepting, adapting, and welcoming help. My healing is adhering to medical treatment, befriending myself. So looking at the mirror and liking my imperfection. And learning to accept the changes in my body and trying to see beyond my disability. My miracle, having a supportive faith, family, and accessing the best medical care. So I've always used this lupus poster. The one there says, lupus is a journey I never planned or asked for, but I chose to love life, hate the disease, and fight. But my own, on reflection of my part, I said, lupus is a journey I never planned or asked for, but I choose to love life, accept and adapt to the disease, and thrive amidst my difficulties. Thank you. And if you need any support or guidance from the Lupus Group, the websites that you can get support, ask questions, and there's also a NorthWest Lupus Group on Facebook that you can contact. Thank you very much.
Thank you, EJ. And are you okay to take
Oh,
questions?
yes, sure.
Please feel free to sit down, use the chair if you need to.
Thank you.
So if anyone wants to follow up on anything that EJ said or ask questions, please, EJ's open to them. Anyone got anything you would like to fill
I was
with?
curious, what was the time frame between being diagnosed with lupus and sort of coming to that place of acceptance? What was that time frame you're achieving?
So I was diagnosed properly in 2012, and it took me till 2018 to really start like giving up the struggle and just relaxing and just accepting that. If you get to see this book, when I think it's called When the Body Says No by Gamma Mate, I started listening to my body and not struggling, because I don't need to prove anything again to anyone. I just needed to listen and stop when the body says stop. And that means I could be getting ready to go to church, and all of a sudden I feel this sense of exhaustion. I just sit back. I was no longer bargaining, that process, let me bargain. Maybe if I push it more, it's just listening. So it took me a while. And remember, I also said that till date, my acceptance is still questioned. So does that answer your question? Thank you.
I have a question. So you talked about the Kubler-Ross model, the 5 stages. So for you, was that in order? So did you go from denial and then tango? Was it in order? Was it?
I feel those for me are frameworks. You can hop from one stage to the other. Because for that, it says acceptance is at the end. But for me, acceptance is stop. So I have to start accepting first, and every other thing follows. And I have to re-accept again. So it's just like, it goes round and round. And still, sometimes you say, you still bargain, I think one of my bargaining tips was my mom telling me a story of my aunt having some health issues, and she was always going to church to pray, and one day the whole thing stopped. So I felt like, if I do this, because it's been done, if I do this, maybe. So it just goes, your pattern is different from every other pattern. Your process is different. Yeah. Oh.
How do you maintain resilience? Like you've used your faith, aspects of your achievements, to put this into perspective for you and gain resilience. And how do you maintain that?
I maintain it by, when we talk about another book again that is quite good is The Body Takes the Score. I maintain that by befriending my body, befriending me, befriending me in the sense that every limitation, every imperfection that lupus might have caused to my body, I try to take it in and accept it and keep moving. And that's where faith comes in for me. And that's where secure attachment with my family comes in, because when you see them, they've not lost hope. They physically might show me that they've not lost hope. Even internally, they're processing their own. But still, because I see them, because they're there, because they understand, because my mom can, in the middle of the night, I can knock her, because her room is just next, so I can hit the wall and and she will know something is wrong, and she comes in because they're there and they have an unwavering support. It keeps me going.
How old's your son?
Oh, he's 12 now.
How did he accept it? Did you have to sit down and explain, like, mummy gets poly or sore or?
No, I've never sat down to explain to him, because I've never. He just knows that mommy is always tired. Now he knows what lupus is, so he's grown with it. So it didn't happen to him all of a sudden. So it's been part of his life. So he knows my mom is always tired. And I think he has my kind of forgetful mind sometimes, that he's clueless. He's like, oh, okay, I'll leave you for now, you know.
Yeah.
But I hope that someday he might reflect on every part of my life, going to the hospital with me.
Yeah.
And it's my mom that has been an adult seeing all this. How she's accepted it is the question for me. But he's grown with it, so he doesn't have an alternative mom.
Yeah.
Yeah. Does that answer your question?
Yeah.
I have a question about acceptance. You said that the acceptance is challenge every time. So my question is, that acceptance, every time that you go through that process, it changes you. And if it comes in waves, and how those waves change you. I don't exactly. I feel that it is like a circle, but goes in upward or something, or at least I imagine that.
Yeah. So the acceptance journey is just the up and down flow of life. So the ups and the downs, you know. And sometimes you stay up for so long you forget what down feels like. So when I get hit back, it is that time to sit back and reflect again. What am I? It's still here. It's not entirely gone, and I need to cut back and I need to rest. And my body is telling me to rest, or there's something that needs to be sorted, you know. So it just goes up and down. And life is that process. I don't think in any aspect of life, in loss of health or whatever thing you're going through, there's always times where you feel, there are times when I feel untouchable. Trust me, I feel like I'm so good now, you know, I could run for MP. But there are those times when I feel like, I can't use that French word, but yes, there are those times when you feel rough, you know. So it's just up and down.
But you go all the time with the days like that, feeling like this is terrible. So that's all it is like easier.
I think it's just that mental understanding that when I need to rest, I rest. Like this morning, I was in a lot of pain lying down on that bed. I was exhausted. I had to sleep like a couple more hours before I could get myself. So it's just that realization that nothing is stable, that nothing is steady, that I just have to take each day as it comes. So one day at a time, one step in front of the other. No rush, my pace. Yeah.
Do you feel like after all you have been through and everything that you have to see and feel, you value the smaller things in life?
Oh yes, I do. I value the fact that I can walk in here today without a crutches or a stick. I value the fact that I could just be here. Yeah, I could take my son to school. I could bring him back. I could try and make food for the family. You know, I could tidy my room. I could not be in bed all day. You know, I could, my son could show off his PlayStation and ask me to play with him. You know, I just value the fact that I could be present. You know, not caught up in the past or whatever the future brings, but that I think I value the fact that I'm alive. I think that's just it. I value that. I value life so much, because I remember sometimes then when it was really bad, like people calling, how is she doing? You know, it felt like people were calling to know, is she still alive? Is she going to make it? You know, there was that sense of loss. And my mom has gone through enough loss. She lost her son, lost her husband. So I think being alive, being able to meet up friends, to crack jokes, to laugh with people, to just be here, that is priceless. I don't make a lot of money. I don't make any, but just to be breathing the same air with other people, just to sit around with my family and have a good time, just to be able to stand up on Christmas Day, even though I know by the end of midnight my foot will be aching, just to make breakfast, just to make pigs in blanket for my son on Christmas Day, pancake and all that, just for them to feel that I'm not dead yet. That is priceless.
Do you think it brought like stability and happiness?
Yeah.
Because I feel like sometimes people nowadays, they have everything. And we are living our lives and bothered for small things that are not even that important sometimes, just because. And when we come to a place, because myself I've been through a situation where I was between death and life, I feel like since then I try to find a balance between happiness, understanding that happiness is not every single minute, that that we have to pick a little bit of every single thing that we have, like moving the fingers, talking, enjoying other people, being able to connect, being able to do hobbies, stuff that we actually enjoy. And that was a curiosity that I had about you as well. If after all that you have been through, knowing that it was a bad thing for one perspective, if it brought something good for you, to your perspective of life and how you balance that happiness and how you feel about it.
Yeah, I think prior to my illness, I was in a different lane or a different wavelength or whatever you call it. I was just, my dream was to finish my master's then and to just get married, have a family. All my friends were getting married. I was seeing things in a different light. Education was not part of that plan. You know, maybe get a big job and just move. But being unwell moved me to a different path to life. And it's funny that I would have to talk, that my illness will make me talk to other people about loss of health. That my illness will bring me to that point to speak to other people. I wouldn't have imagined it if I had gone the other way. If this hadn't happened, I would not be here, trust me. But it's funny that my illness had made me understand that there is actually more to life. You know, that it's not just about the fast lane, it's not about what's on social media, it's not about who I need to impress, it's not about it's not about what I need to look like, it's not about every other person's life or what is trending or what every other person is doing, how successful every other person is. But it's just that what you said, those little things matter. Those bits of little happiness are what matters, you know. Just having people sit around and having a good laugh with them without a care in the world, or just appreciating that you're here and that we're not gone.
Any more questions? I have one, if that's okay, AJ. So you mentioned about your mum's sense of loss, and she sounds like she's been through bereavement, and I just wondered how far her, what did you observe in her in terms of your loss of health? You know, did it follow like the Kubler-Ross model? Were there similar themes there, or did she follow a different path, and how did she sort of deal with that?
I think I should bring my mom to answer that, but
Yeah.
I think my mom was 24 when my dad died, and before my dad died, my brother was diagnosed with retinoblastoma, so he had cancer. So my dad's death was a shock on its own because it was just a brief illness and then taken to hospital and then pulmonary embolism, and it was quite quick. So she was in shock, and 3 months later her son died, and she wasn't aware that he had died because she was writing her final year exams in uni. So that shock because she was praying, and this is where faith comes in, because she was praying and saying to God, heal him. He was in England he'd had a surgery in Nigeria where they took away his eye, but unfortunately didn't do radiotherapy, so the cancer metastasized. So by the time he was brought here, nothing could be done, and she was in school. So that process of shock from the death of her husband, she was clueless. She was like, what is happening to me? And then the death of a son within 3 months. And she said she would take my brother's clothes and be smelling it in secret. And she wouldn't want anyone to like come close or wear me that dress because she just wanted a part of her son. And I think that loss goes like the dual process of grief, you know. So then she used faith, and I think her part of faith was she wanted someone to tell her what happened, who, coming from my culture, who killed her husband, you know. But she needed that answer, so she was going from one prayer house to the other to find resolutions for that. But all of a sudden, something changed in her, and she said she found not going from prayer houses to prayer houses, but to have her own relationship with God. And unfortunately, by her finding her relationship, because I would say in the Kubler-Ross's, at the point she was bargaining, you know, I need to find what happened, you know. But for her to accept, she felt that she had a relationship with God for her to stop and accept. But unfortunately I'll say unfortunately for her, when she accepted, then my illness started, so she had to go all over that again. So she has learned to accept it from a Christian perspective. She calls it her cross. Knowing that she's going to not go to work if I'm unwell, and I might get better in the afternoon, and maybe when her colleagues come in, I'm looking okay, and they feel, what the hell is she talking about? But it's that her acceptance. And I think that's what the process just goes differently. Everyone's process is different. But I think her faith has been her bargaining chip, and acceptance and adapting to the fact that anything can happen to me. So as I'm adapting, she's also adapting.
Okay, any final questions then before we let AJ have a rest? Okay. Well, thank you very much for that insightful presentation. I think you know, it's really helped to bring the theory as well to life in terms of your lived experience, and I'm sure it resonates with people in here and the experiences perhaps they've had or family members have had. So once again, just thank you very much.
Thank
AJ.
you for having me.
Okay, so just